I think to really effectively provide good care for patients and to help with families, I think working in teams really provides that opportunity. So the different professions collaborating to provide outstanding care.
And I think with that, it's less of a burden for the clients we serve and their families to have a group of people working together so that questions can be asked one time and answered, but the whole team can be privy to that answer. So that maybe more than one member of the team comes to the room for the initial assessment, so that clients and families can see that there's a team wrapped around them. And if they're speaking about their medications, for example, the pharmacist, physician, nurse can all be privy to that conversation at the same time, so that we don't end up burdening clients with the same question by 3 different professionals and 3 separate sets of documentation on the chart to really capture one item that all 3 people might be involved with.
What I'd like to add to that from the client's perspective is the element of choice as well and comfort, because clients may be more comfortable with one member of the team and really relate to them and establish a rapport. So that allows that same flexibility that Susan just mentioned around sharing the information amongst the team members without having to repeat it several times, while allowing that client to maintain an established relationship with a clinician.
I think we've seen across the Royal in many of our programs, we're already actively engaged in interprofessional collaboration and team-based work. Mental health and addictions care has often involved a group of people coming together to weigh in from different vantage points on what might best benefit a client, and of course the client and family members as a part of that team, informing the team of what they want to have happen and what they think is best for their own care. So I don't think this is new for the Royal. This is the next iteration. So how can we make this stronger? How can we ensure that all of our care and practice is team-based? Because there is also a safety mechanism that's in place when you have a team. A greater number of minds weighing in on a complex problem provides for a greater opportunity to get the right mix of interventions, for example. So we do this now, and I think that when Raj refers to an infrastructure to support a local team, those who do the work know the work best, and the clients who receive the work or receive the services, they too know what's best for their lived experience in care. So really it's that mix of people, the direct clinicians and the clients, who need to be working together to define what that structure might look like for their particular area of interest.
So if we're going to effectively advance team-based care, we have to ensure we let teams do a certain amount of self-regulation. As long as they're moving in that direction, I think that's going to be remarkably helpful. But if we overly prescribe exactly what that team-based care is going to look like, I think we're going to run into some trouble. Teams are best equipped to sort out the needs of the clientele and the families that they serve. So we've got to leave a lot of room for teams to work within a model that is team-based.
And remember that teams, when we talk about team-based care, we're not talking about a team that looks the same and is stable over time or stable across programs. So each client that presents to us, you might assemble a slightly different team. So if someone comes for an assessment, for example, and the referring information includes some really difficult medication issues, for that particular team that might approach that consult, it could be a physician, a pharmacist, and a social worker if there are family issues. But someone who doesn't have complex medication issues and doesn't have medical comorbidities, perhaps the mix of team looks different. Perhaps it's a registered nurse and occupational therapist if activities of daily living are the biggest challenge, and a physician if diagnostics are of concern. So even the notion of team-based care, that team ebbs and flows depending on the client needs and the presentation, and depending on the program. Some of our programs have a different mix of staff at the starting point. So we don't have addictions counselors, for example, in all of our program areas. So they'd be a member of a team in some, but not a member of a team in others. So we've got to think about team-based care not as a static and stable one-size-fits-all model, but rather a local decision made based on the client and family in need at that moment, and who best wrap around that client and family to provide care. That becomes the team in that moment, and best defined, as Raj points out, by the family at hand and the team that weigh in. They're best to decide who from the team would engage.
I think there's going to be a variety of indicators that tell us we're doing well. I think we'll see satisfaction rates go up in general. We will see quality indicators go up. And I think we'll actually see some efficiencies in terms of wait times, wait lists. That will also be a benefit. So there's going to be a variety of things in different program areas. Probably others as well.
Yeah, I think you're absolutely right, Raj. I think that the satisfaction for the staff comes from being able to spend more time doing what they love to do, which is being engaged with clients and families. It does have the potential to streamline documentation, for example, rather than each clinician documenting a piece of an assessment. You now have one comprehensive assessment documented that captures the engagement of whatever team went first with that client. So you end up freeing up time for clinicians to work more directly with care, and with that you always see an improvement in satisfaction both from our clients and from the staff.
I think stakeholders are going to be more satisfied as well, because they will have a variety of individuals from a team with whom they can have contact regarding the transition of that client from our care to their care. And I think that'll be strengthened through the team-based approach.